Hello everyone, my name is Hyun Song and I'm a reporter at JSTV. I'm also research assistant professor at the Vanderbilt University Medical Center. So today, Hyun and Simon Chun and Ki Park will give the 20-minute lecture. And the title is that call for humanitarian diplomacy in the Korean Peninsula. So first, let me introduce Simon. Simon received a PhD in the political science at the University of California, Santa Barbara. And right now, she is the professor at the Northeastern University. Simon is one of the best Korea experts in the United States. Also, she is the activist. Simon used to work with Professor Noam Chomsky to protect the democracy and the human rights in the South Korea. Simon, could you introduce Ki Park?
Thanks, Hyun, and thanks JNC-TV for sponsoring today's webinar. It's very important webinar on a very timely issue. And I would like to introduce Dr. Ki Park. He's a lecturer on global health and social medicine and the director of a Korea Health Policy Project at the Harvard Medical School. He's also the director of the North Korean program at the Korean American Medical Association. And since 2007, he has made over 20 visits to DPRK, and most recently in November 2019. His academic interests include DPRK public health and the role of international organization factors influencing humanitarian aid, the relationship between international security, health, and human rights and health diplomacy. He's a member of the National Committee on North Korea and the Council of the Korean Americans. He received his Doctor of Medicine from Rutgers Medical School and the Master of Public Health from Harvard Chan School of Public Health. He's a diplomat of the American Board of Neurological Surgery. It's a great honor to join Dr. Park today.
Thanks, Simone. Hyun?
So let me start. Okay, let me share my screen.
Today, I'll introduce the brief summary of the COVID-19. Coronavirus called COVID-19 was emerged in Wuhan, China in December 2019. This virus is a large family of viruses such as SARS and MERS. It has about 80% sequence identity to SARS. And it turns out that COVID-19 was originated from bat and transmitted from pangolin to humans. So question is that why COVID-19 is dangerous than SARS? Because its binding affinity is about 10 to 20 times higher than SARS. Higher binding affinity means it is easy to bind to the receptor, therefore easy to enter the cells. COVID-19 has the 3 receptor binding domain. This is the cryoem structure of the COVID-19 published last February in the Science. You can see green, yellow, and magenta from the trimer structure. I just pick up one chain and the color it depends on the domains. So green is the receptor binding domain. This is very important because if this cannot bind to the receptor, then it cannot enter the cell. Next, I compare the structure of COVID-19 and SARS. Green is the COVID-19 and blue is the SARS. As you can see, two structures are quite similar except the receptor binding domain. Then I just align the receptor binding domain, but we can see still there is some difference. So next question is that COVID-19 was engineered. I think everyone already heard the rumor that the COVID-19 was engineered in the lab in China, but that's fake news. According to the Scripps Research Institute, there is no evidence that this virus was made in the lab. They compared the backbone of the protein and found that the backbone of the COVID-19 and SARS were different. So this is my last slide. This article was published by Dr. Neil Ferguson. He is the mathematical epidemiologist at Imperial College London. So in this graph, x-axis is the time, y-axis is the critical care bed occupied per 100,000 in the United States. If we do nothing, we will meet the surge on May, and the color is the dark orange. But if we do case isolation, household quarantine, social distancing, and the school university closure, we can delay this kind of surge until September or November. However, according to this model, if we stop such kind of measurement, we might see another second wave at the end of this year. I hope this model is wrong, but we need to keep an eye on this model because this can be a warning. Okay, thank you so much. Simon, could you start?
Just let me know if you can see my. Thanks, Hyun, for an excellent scientific explanation of COVID-19. Now let me turn to my analysis focusing on North Korea, titled Appeal for Humanitarian Diplomacy in the Korean Peninsula. My objective is to provide an update on the current state of COVID-19 in North Korea and recommend alternative policies. I'm going to argue that lifting sanctions against North Korea is critical to address the potential spread of the pandemic there, and we ought to jointly respond against COVID-19. Now let's first look at the current state of COVID-19 cases around the world. As you can see, the pandemic has affected many countries and territories around the world, infecting over hundreds of thousands of people and claiming thousands of lives. In the midst of one of the worst pandemics in recent history, one country still has not publicly confirmed a single case. That is North Korea. North Korea closed its borders in January, restricting social activities and placing thousands under quarantine, but it has yet to announce a single confirmed case of COVID-19. On March 27, North Korean officials selectively lifted quarantine in some areas exhibiting low infection rates, but thousands still remain confined. Many are skeptical of the apparent lack of confirmed infections in the north, including South Korean Prime Minister, who stated on March 27 that the outlook for the north is likely not good. Agreeing with assessment of South Korean doctors following the situation, they point to Pyongyang's March 20 announcement regarding the release of quarantine restrictions from close to 8,400 cases. Now, based on these and other compiled data sources, South Korean doctors estimate at least 8,300 suspected cases of COVID-19 in the north, with many potential deaths. Now, with this background, I will focus on following topics. First, I'm going to look at some basic facts and the timeline related to the state of COVID-19 in North Korea. And then I'm going to argue for exporting essential medical supplies to North Korea, and to stop U.S.-South Korea joint military exercises to create a state of peace and implement an inter-Korean humanitarian regime, and pursuing a people-centered human security paradigm as an alternative vision. Now, let's look at some of the facts that we can gather from available sources. Now, as I mentioned earlier, there's 0 confirmed cases. And according to the COVID-19 tracker prepared by NK-Pro, about 64 days since travel has been restricted in North Korea, and 10,000
10,620 people have been quarantined. And out of 10,620, 10,518 people have been released. And 11,500 test kits have been delivered. About that number, 10,000 test kits have been delivered to North Korea from International Federation of Red Cross and Red Crescent Societies, and 500 test kits were delivered from Russia. Now that's the current state of COVID-19 cases in North Korea. And the main takeaway is there's no confirmed case. However, there are several important developments. Now let's take a look at it. The timeline. January 25th, North Korea seals border with China. Now, this is important because the trade with China came to an abrupt halt, and the many North Korean merchants were not able to get goods from China to sell in local markets. Therefore, shortage of supplies quickly ensued. There caused a sharp increase in the price of staple ingredients like flour, rice, and so especially because it increased the price of rice, it's going to worsen the hunger and food insecurity, which North Korea is already suffering from. And according to the South Korean Ministry of Unification Research, more than 50% of North Koreans are now getting their goods from private market. So closing the border with China will have greatly affect the lives of ordinary people. Okay, let's go back to timeline. March 20, according to South Korean analysts, North Korea might have suspected about 8,300 cases of COVID-19. Again, this is not North Korean official data, it's about South Korean analyst data. March 27, North Korea appeals to international assistance, which was clandestine appeals, and this was reported on the Financial Times. April 1st, a United Nations allocates 900,000 for COVID-19 response in North Korea through World Health Organization. And on April 2nd, South Korea approves private COVID-19 aid to North Korea. Now, what is a takeaway? Main takeaway is that North Korea, in spite of claiming zero confirmed cases of COVID-19, based on the development, it has been trying to battling the pandemic, at least taking precautionary measure. Now, the next slide is an image of an international freight train between North Korea and China. Now, this is important, as I mentioned earlier, because it's going to closing North Korea relies 6% of its trade with China, and North Korea's economy is directly linked to China, and closing this border is going to have directly impact the ordinary lives of people. Now, and also, as you can see with the next few images, how the not only the pandemic itself, because of North Korea's under triple hardship, that is the unending Korean War and the crippling sanctions, and then now this threat of the pandemic, its impact on the ordinary people is going to be just tremendous, which is why it's urgently that we need to pay attention to. And especially the North Korea that already experienced deep hunger crisis and also the double with the threat of pandemic will have a devastating impact. Now, and nevertheless, to reiterate, North Korea has responded, including if you look at some of these images, and plan to build a new general hospital in North Korea, in Pyongyang, and also revising those new laws about the preparing for epidemics. And nevertheless, North Korea still is, as you can see from that slide, is ranked at the bottom in terms of the preparedness for an epidemic. And I argue that therefore this new situation, sanctions and the pandemic, can be a deadly combination, which is why it's important to pay attention to the current state of COVID-19 in North Korea and the skepticism of North Korea's claim of being COVID-19 free, and most importantly, sanctions impeding North Korea's COVID-19 containment effort ought to be taken seriously. And also, because of crippling sanctions, North Korea is already, as I pointed out earlier, ranks the third to last new global health security index. Because of out of this concern, I did publish an op-ed piece on Hangare, which is progress newspaper in Korea, under the title of Approval for Humanitarian Diplomacy in the Korean Peninsula. And there I argued for an appeal for humanitarian diplomacy, which means the followings in my view. A, it means that immediately authorized export of essential medical supplies to North Korea, and which I'm going to leave discussion more to Dr. Park because he has worked with North Korean medical health of professionals for more than 20 years. And I will just add that North is highly vulnerable to health crisis because of its having been subjected to a wide range of long-term economic and financial sanctions. And these sanctions, which even includes like bans on metal goods that block the entry of a range of necessary medical equipment without special permission, have caused a critical shortage of life-saving supplies. And also those people, especially hard will be people, 10 million North Koreans, who are about 30-40% of population who are already in need of humanitarian aid. So which is why we need immediate relief, immediately authorized export of essential medical supplies to North Korea. Now, under the international sanctions and also now self-embargo due to pandemic, North Korea cannot receive meaningful assistance from outside. It does not have indigenous resources and technology, and so therefore it is trying to overcome this crisis on its own. And even this is really, it will be impossible task, especially at a time when even wealthy nations such as U.S. are reaching out for help to fight the pandemic. Now, and other more recommendation is that yes, the U.S.-South Korea joint military exercise have been temporarily suspended, and perhaps we should permanently suspend, because whenever U.S.-South Korea joint military exercise take place, North Korea has to spend enormous of resources to respond to that. And moreover, South and North Korea should implement an inter-Korean health and humanitarian regime. That means that we should start cooperating on addressing public health care issues. And we can also, Korea can also look to the precedent set by West East and West Germany. They actually implemented a public health treaty 10 years prior to unification and creating a shared system of addressing public health crisis. And also in the Pyongyang Declaration of 2018 clearly stipulate that two Korea will jointly work on addressing public health crisis. And finally, thinking about our long-term vision, that is, we ought to develop a people-centered human security paradigm as an alternative vision. So end the Korean War and lift the crippling sanctions that block the ability, North Korea's ability to purchase medical supplies and fight COVID-19, because sanctions are cruel and sanctions can kill. Sanctions is war on the entire population. And I have few more images about thinking about continuing inter-Korean engagement, which includes the future prospect. And let me pause here and turn to Dr. Park. And Dr. Park is director of North Korean Health Policy Project and the faculty member at Harvard Medical School. He has years of experience directly working with healthcare professionals in North Korea. It is truly an honor to have him today's webinar. And here's Dr. Park. Thank you.
Well, thank you, Simone. That was super helpful recap of what's been going on recently. a much broader picture as well. Thank you, Hyun, as well for inviting me to this really important webinar. So yeah, what we have here is a country which is very low income country, right? North Korea. And they're being sanctioned. And then we're not gonna get into the why and whether even sanctions are effective. But we're gonna talk about how these sanctions are impacting the ordinary people of North Korea and their health. What it is a story of a very large country, US, and how they're choosing to exercise their powers in a way to further their national interest, but with almost zero accountability. And it's having a deep impact on innocent people, not just in North Korea, but countries like Venezuela, Syria, Yemen, Iran. So I want you to keep in mind, this will be somewhat of a criticism of US policies, but not all of it. But that's really where I'm going with this. So the sanctions, all the UN Security Council sanctions on North Korea have in there a single clause, every one of them says these sanctions are not intended to harm the lives of ordinary people of North Korea or impede humanitarian assistance. And there's a reason why it's in there, because we've been through this before. During the Iraqi sanctions in the 1990s, these sanctions pretty much crippled the entire the Iraqi economy. And there's an estimate that up to maybe 250,000 children, Iraqi children, may have died as a result of this. And so there were some accountability mechanisms that were placed to sanction senders so that these things don't happen again. For instance, pre-sanction humanitarian assessment, status assessment, ongoing impact assessment, facilitation of humanitarian assistance. But none of those things were being followed in the North Korean sanctions. And when we talk about sanctions, I just want to do a little bit of give you a sort of a perspective. It could be sanctions based on, prevention of weapons, and that's one type of what we call smart sanctions, because it doesn't impact ordinary people typically. But then there are these broad sectoral sanctions that cripple a country's economy, and that's where we are with North Korea right now. Imagine if the US, all the Americans, have to live with 10% of the oil that we were using last year. We were forced to live on 1/10 of fuel that we were using last year. That's what North Korea has to deal with. Imagine if the US were forced to, their exports were all blocked, the main export sectors. And that's what's happening in North Korea. Of course, these things are gonna have an impact on the lives of ordinary people of North Korea. Transport costs are going up, food costs are gonna go up. You're talking about a country that's already 40% food insecure, and they have to supplement their food intake by buying things. And their income, garment industry, export, seafood industry, all those jobs went away when these sanctions were placed. So these sanctions, although they're not intended to impede or impact the North Korean people, impede and aid to help them, they do. Now, last year, we published a report. We wanted to estimate how many people could have died as a result of these sanctions. So we looked at the UN agencies that are working inside North Korea, and then they report every year what they intend to do and what they're able to achieve. And they were crippled by two things. One is the sanctions, which delays their ability to bring in humanitarian goods, and then the funding. They had requested $111 million for urgent humanitarian assistance, and they were given $24 million. I don't know if you know how UN system works, but that's probably gone to paying for salaries and office space and things like that. So what we were able to find out is that we're estimating some of the programming activities. I'll give you one example. There are these emergency reproductive kits these kits contain medicine and things that are very important when a woman experiences complications during delivery, right? So these kits are known to save lives. And they were intending to deliver 400,000 kits to North Korea in 2018, but they only delivered 4,000. So vast number of mothers in North Korea who would have benefited from these kits when there were complications like hemorrhage, eclampsia, they didn't have that. So our study looked at these kits along with severe acute malnutrition, water and sanitation, and we estimated up to 4,000 North Korean people could have died. And most of them were children, over 3,000 of them under 5, as a result of the sanctions. So sanctions have a real cost when it comes to the lives of ordinary people in North Korea. Let's just talk about the coronavirus situation. It's absurd that UN agencies and humanitarian organizations have to go through a exemptions approval process. So they have to create a list. It's like applying for a visa when you want to go into, let's say, Russia. I don't know if you've ever been to Russia, but their forms are forever, right? It takes like 10 pages. But you have to fill these out, and then you submit it, and then they have to give you an answer and says, yes, you can take this in, or you can't take this in. In 2018, it was taking between 6 to 9 months initially. And then we published this report, and then they brought down the delays to down 2 weeks. I will tell you that the UN Security Council, in the context of coronavirus 19, they have facilitated to now almost 2 days is the maximum for approval. So I am critical on one hand. On the other hand, they are doing the best they can within the rules that they're doing. But it is still absurd that you have to ask permission to deliver emergency assistance in a setting of international public health emergency. It makes no sense, right? But that's the current framework and the regime that we have to navigate. If anything, the COVID-19 situation has really highlighted is the absurdity of this sanctions and the humanitarian exemptions process. It simply doesn't work anymore. And what they should be doing is really saying there's a waiver, right? Saying any humanitarian aid organizations, you don't have to get permission from us. Right now, the WHO has declared this as a pandemic. Go ahead and send these in. It's about saving lives. And so let's just kind of zoom out a little bit. Why are we in this situation? Why are governments still able to bully, right? And have these kinds of steep human costs? Another example is the U.S. government recently just vetoed a $5 billion loan to Iran to help with the COVID response. I mean, so if you think about it, the governments are prioritizing security, national security over other people. And I'll finish with this one question. Are we, and so I'm seeing mostly Americans here, as US citizens, willing to accept deaths of innocent women and children in other countries in the name of national security? Because that's what's happening right now. So I'll stop there, and I'm sure there'll be a ton of questions, and happy to answer them. Thanks.
Thank you. So the supporters of sanctions on North Korea always say that humanitarian shipments are allowed, and Key, you just said that is ridiculous. So how do we, get a dialogue between these points of view so that they actually listen to the facts? How do we break through that denial?
So yes, even Pompeo, you heard him the other day saying that medical supplies are exempt.
Right.
And he can say that because they are exempt. But what happens is that if you look at, let's talk about North Korea. North Korean sanctions regime, the UN Security Council's regime, is the most complex ever in history. And to go through all the sanctions and all the prohibited items that are on the list, it makes it very scary. For instance, I'll give an example. Metal was on the prohibited list. So you look at scalpels, right? Is that prohibited? So so the most organizations, humanitarian organizations, we don't want to be a foul. right? They're the major implications of being named on designated list. So they take what they call, they over-comply. They over-comply, which means they, just to be on the safe side, let's make sure we get the permission. So yes, now the Sanctions Committee they can go through things. And what they do is they tend to broaden and narrow the definition of urgent humanitarian needs based on the political environment. And that's what they dial it up and down. So right now it's actually open because of the COVID-19 situation. What the Sanctions Committee is doing is approving it with a 2-day silence period. So which means if nobody objects, it's approved automatically. Plus, they aren't parsing it out like they used to. They're just approving things, you know, as a whole package. So yes, in theory, they are exempt, but no one will, actually, I'll take that back. So most UN agencies and NGOs are very legal, very compliant, right? They want to be compliant. Now, I think I want to give 2 examples of where I think the sanctions exemptions were not obtained in the COVID context. The Russians sent in 1,500 test kits in mid-March, and we're pretty sure, and in fact, I know they didn't get sanctions approval. And you know, the NGOs, like WHO, IFRC, MSF, they are all getting approval for even test kits, right, from the Sanctions Committee. But I think the Russian Federation, they didn't get approval. And I don't have definite facts or evidence, but I'm pretty sure the Chinese have been providing assistance to the North Koreans quietly, and they don't publish it. And I'm sure they're not getting sanctions approval.
So I also responding to Sakato's question, which was the good one. Satoko asked the source of the North Korean estimating to have almost 8,300 cases. Now, again, I wanted to clarify, this is not North Korea data. This is data this is estimation research done by South Korean analysts. They looked at North Korea report, says that 4,000 residents of Pyongan-namdo had been quarantined, 1,430 from Gangwon, 2,630 from Jangan-do, and 380 foreigners. So based on this data, South Korean researchers estimate that maybe there are as many as more than 8,300 cases of coronavirus in North Korea. In fact, maybe many potential deaths. So again, this is not there was not North Korea data. It was data provided from released from North Korea and then analyzed by South Korean researchers.
Thank you very much. If possible, could you provide any news report or source? You know what you just said about the South Korean analysis. Is there any information on the web?
What I will do is I will. It's Korean. It's in Korean, so I will give you the link. So if you need the translation, I'll be happy to help you too. But anyways, I will give you. And yeah.
Thank you.
As far as I know, the WHO and the Ministry of Public Health of North Korea, they're stating that there are no confirmed cases of COVID-19 in North Korea. And this, I think, was accurate until a few days ago. And the question comes up whether or not this is accurate. I mean, one way to look at it is maybe there are cases, but it just hasn't been detected, right? There was a delay in North Korea acquiring actual test kits, testing capacity. So they actually have the machines that can run these tests. These are these machines that detect fragments of DNA and RNA. So they have it, but you have to have the right test kit to run on these machines. And my understanding is that until the Russian kits arrived about middle of March, they weren't able to test for COVID-19. So now they have been running these machines. My understanding is that they're able to do about 60 tests a day. So it's been about 2 weeks. So we think they have done about 1,000 tests. And so we'll see. It remains to be seen. I think they're actively looking to see if they can find it, but they haven't found any yet.
United States have a lot of coronavirus, I'm just wondering whether it's possible to any talk between North Korea and the United States in the near future.
I'll answer it this way. So there was a letter, right, that
Yeah.
Trump sent to North Korea. It
Yeah.
seems like it was fairly recent. The timing is not good domestically, right, because we're sort of dealing with it. We're neck deep in the situation, but the offer is there. There were two things that the U.S. government did in regards to North Korea, a COVID situation. One is they had a press release in middle of February. I think it's February 13th or 14th from the State Department, really saying that we are concerned about the vulnerabilities of North Korean people in this COVID situation. We support international cooperation, and then we will expeditiously facilitate any kind of approvals. And they meant it, and they followed through with that. So there was a rare display of solidarity between the U.S. and North Korea, North Korean people, a concern for them. And then there was this letter that was delivered. So I think this is a fairly important observation that there was, at least from one U.S. side, they want to help, and then they're following through. The problem is North Korea in this situation, I think, should be more willing in some ways to engage, because they're going at it in a very isolated way. And you really, sometimes North Korea says, hey, to the international community, you are politicizing assistance to us. And that's true. We do, right? We do it all the time. And I totally disagree with that approach. It should be based on need. It should be impartial and neutral. But having said that, there's a component of that hypocrisy in that statement, because the North Koreans also will engage with donors, and it tends to be politicized. Look at what's happening with South Korea. I know for a fact that the South Korean government and NGOs wanted to help as far back as 2 or 3 weeks ago, when things were about a month ago now. And North Korea was very unwilling, I would say, to engage in this kind of bilateral assistance. And so South Koreans were looking for multilateral platforms or donors that were already being asked to give assistance and deliver packages that way. And I think North Korea could make it easier to accept assistance.
Several days ago, President Trump said he's willing to help North Korea about this COVID-19. But there's so many news right now. Like last week, one of the Korean boy who is in high school in Lancaster died because he didn't have the insurance. And not only that, for instance, so many other people in US, they need more test kit. Even I don't know if I have coronavirus infected right now, because we cannot have a test for the, everybody. And it's very limited. Do you think if the Trump help North Korea with those kind of things, do you think Americans can understand that?
I think first, I think we should actually still, when I was writing an op-ed about this topic, I did mention about President Trump's offering of assistance to North Korea, and I thought that it's a good, gesture, but at the same time, still very fall short of providing very immediate help, such as lifting some of those sanctions so that North Korea can get the medical equipment. But I think, Laura, you're right. I can see that its timing is not good, especially when Trump is not himself is overwhelmed by about dealing with the coronavirus case in the United States. So people will say, oh, you're not doing anything to help us. So what's how can you help? Trying to pretend to help North Korea. So I can see that there is that dilemma. But on the other hand, that's why I think in a way. Maybe it will be another way to do it is to really, maybe to more encourage, more support into Korean relationship. As South Korea has somewhat successfully, it's still dealing with it, has successfully dealing with their coronavirus. And maybe this is time, maybe Trump can say, okay, this is time, maybe we can directly support and encourage, inter-Korean engagement, because he has a lot of here. So that could be another possibility. But I agree with you. So I'm skeptical.
I'll just follow up on what Simone said about at least the inter-Korea situation. There was a letter sent by Chairman Kim Jong-un to President Moon Jae-in as well, just when the South Korean COVID cases were starting to explode, expressing concern. And so they're talking. There's a channel of communication, a level of concern and solidarity. I think there's an opportunity here. When you get a letter, usually there's a reply. So with that reply can go, some additional offers and actionable items. So we'll see. That could be why the North Korea has agreed to take the hand sanitizers from a private NGO. And that's a good start. I'd like to see more things being delivered. South Koreans are, as you know, testing experts, right? So that they have the kits. Looks like we're going to buy them too in the US. It'd be great to see those tests sent to North Korea as well.
So I'll just add that this, as many point out that this is a time of crisis, but it can turn into, as also Kevin Martin pointed out in their op-ed, you can turn this crisis into opportunity. And I also want to mention that, based on my research, East and West Germany, they had signed what it's a public health treaty 10 years before unification. So maybe Korea can, start working on addressing public health crisis, and then this can be sort of a stepping stone for great cooperation in other areas as well.
Thank you for everyone for joining us today, and thank you for Kipak, and thank you for Simon for excellent lecture, and thank you for everyone for excellent question and answer. So I hope to see you next time. Okay, bye everyone.
Thank you very much.
Bye.
Bye. Thank you.
Bye.
더 나은 세상을 위해 공정한 언론의 역할을 다하고자 노력하는 JSTV는 전 제작진의 자발적인 참여로 만들어지는 독립 언론이자 대한 매체입니다. 방송이 마음에 드셨다면 응원의 표시로 지금 좋아요, 구독 버튼을 눌러주세요. 감사합니다.